Welcome to another episode of Conversations for Sustainability. Today we are joined by our community leader, the Honorable Discent Bajila, who is going to take us through his role as an MP and as a part of a member of the Portfolio Committee of Health and Childcare. So can you please help us have an appreciation of what your role is on the Portfolio Committee of Health and Childcare?
I'm currently the acting chairperson of the Portfolio Committee on Health and Childcare. The chairperson, Honorable Dr. Thokozani Kupe, is on leave and I am acting in his place. Generally, the Portfolio Committee on Health and Childcare does oversight over the Ministry of Health and Childcare, basically in terms of its functions, how it disperses or how it uses resources given to it, how it implements government policies in terms of supervision, and generally in terms of how it responds to health emergencies as they come on board. That is how we do oversight over the Ministry of Health and Childcare.
Okay, and how then does it trickle to the people on the ground? What processes are there?
Well, health is about the individual people on the ground. So what we focus on is how does the implementation of government policies relating to health affect the individual person on the ground, and as well as how they affect groups on the ground. At the end of the day, the state of the individual is paramount to us as the Portfolio Committee on Health and Childcare, of course followed by the state of score of families. So that is how the individual features and the person on the grassroots in our plans.
That's interesting. I think you have highlighted the need for preventative measures, and speaking now into your initiative of the donation of the TV sets that you did as the eMakhandeni Luveve constituency. What was the idea behind that? Why is that important?
If you look at our health expenditure as a nation over the past few years, even in the period preceding COVID-19, you will see that the bulk of our health expenditure has been going towards curative services, where we are focusing more on people who are already infected by this disease or another. And then we are putting much of our money in taking care of them so that we can either cure that disease or assist them to live with that disease. We need to do public health education. We need to ensure that in rural areas, we invest also in making sure that we've got public toilets that are functional, and even the state of public toilets in urban areas. All this falls under preventive. We can prevent a number of diseases. So I have thought of local clinics and said that if you look at the times that people spend in our clinics, many people actually complain that we spend a lot of time, this time needs to be reduced, we need more health workers and so forth and so forth. They are very correct. If we get to employ more health workers, it will mean that one health worker has to look after fewer patients. But also we can have television sets around waiting areas in our hospitals and in our clinics, so that we use their waiting time as time to educate them on how to prevent a number of diseases. So I have started here in eMakhandeni Luveve constituency. We have got 2 public clinics here. We have given them a television set each. We hope that we will be able to, first of all, increase the number of television sets within this very constituency. But resources permitting, we will make sure that even our referral hospitals such as Mpilo, United Bulawayo Hospitals and Ingujeni here in Bulawayo have this kind of equipment, but also even talking to other members of parliament and other well-wishers out there, that we have this kind of equipment even across the public health clinics across the city of Bulawayo.
There is also a need for our residents to actually have a relationship with their representatives, because this particular donation actually reflects that relationship and that knowledge of the needs of the constituents. I hope the area, or should I say the constituents, would develop a further relationship to an extent that any time the Member of Parliament would have his finger on the pulse, as we say in health, knowing what the constituents want, needs, and what their troubles are, such that should he make a donation or source any assistance, he would be, in the proverbial way, scratching where it itches.
Siyabonga ukuthola i-TV esiyitholileyo njengesigaba kuzasincedisa kakhulu kumphakathi, ngoba abadala bazabe bethola imfundiso laphana nxa bebebuye ukuzothola usizo ekliniki. Khonaphana kuzasinceda ekuseni silama-section esiwayenzayo njengekliniki ukuthi siyabe sifundisa abantu, kodwa khathesi kuyabe sokulula ukuthi abantu bahle befike bethi nxa befika bengena laphana bayathola imfundiso through i-TV yana leyo. So mbona ngani kuzasiphathisa kakhulu. So far njengoba siyitholile i-1, ngesishiso sami bengifisa ukuthi OI lakho kuba le-TV yokuthi labana babe behleli bemelele i-medication yabo labo bethole usizo ukuhambelana nalokho abakulandileyo khonaphana. Siyabonga.
So you have mentioned the amount of time that people spend here, in the clinics. And also when you look at budget consultations that are done, there has been this conversation that the people are attending, there's like an 80-20% ratio where only 20% of the people attend these consultations. And they're determining, or they're making submissions on behalf of the other 80% that didn't attend. And now the clinics themselves kind of attract a lot of people who are coming here, for different services. What opportunities are there now that they can also kind of, get information of other processes relating to their day-to-day lives with these TV sets?
Thank you so much. You bring forward a very interesting and valid point. The first port of call is that we must make sure that our health centers deliver on their primary focus on health services, and they must not be disturbed in their role of delivering health services. That therefore means that it is important to keep the health environment as civilian as possible and as non-partisan as possible. What it would then mean is that while we recognize that this is important, but we must also recognize that health centers attract a lot of people by their very own neutral nature, because health is a neutral matter. So it will be important that once we have these television sets here, civil society, the Zimbabwe Electoral Commission, and other independent commissions find means by which they can partner with health centers, so that even that human rights kind of education could also find spaces for expression even within this equipment that we are providing in this area. And I think that an arrangement can be made. Our role must be to ensure that as members of parliament, as public leaders, we make sure that this equipment is available here. The rest must be left to civil society, independent commissions, the churches, and so forth, to ensure that their neutral information is made available through memorandum of understanding, through types of agreement that they can make with maybe the Bulawayo City Council Health Department or individual clinics. It is important that this information that is also not health related but beneficial to the public can also find itself in these institutions.
Thank you so much, Honorable, for your time. And I think as we're wrapping up, could you please just share with us what platforms are there that can ensure that the communities, residents, individuals are able to partake in decision-making processes?
Well, currently we are using WhatsApp. The community has been communicating directly using WhatsApp. Some have even approached me through Facebook and through X. So social media is coming as a very important tool in deepening our conversations with society, but also in making sure that these conversations are continuous, because the conversation might be deep but once off. But these conversations, we have managed to have them continuously. But we're discussing also with the councillors who are stationed throughout the constituency, having offices that in the medium term or in the long term, we might be having books where people can write down their suggestions again and again, so that maybe weekly or twice a month we are able to go through what the people are saying and find means of making responses to that. We are making that kind of arrangement, and we think that by the time we end the first quarter of next year, that arrangement will be operational, and people will be able to visit the councillor's office, not only talk to the councillor, but also have an opportunity to send 1 or 2 messages to the member of parliament. It will be very good if parliament secures land in Bulawayo, so that we can have parliamentary constituency offices, because that is part of the strategic plan of parliament to ensure that we have parliamentary constituencies throughout the country.
Well, thank you so much for that. Is there any word probably that you have to kind of close our conversation relating to this relationship that needs to be cultivated between the community and its leaders, and how it can be maintained?
Well, thank you so much. Well, my philosophy of politics and representative democracy is that an elected representative is a servant of the people, but it's not a once-off thing that once we elect you, we told you what we want, you agreed that you will do it for 5 years, go and do it, see you 5 years later. It doesn't work that way. I believe that the interaction must be continuous, and when that platform for interaction, for continuous interaction is created, it must be utilized to the best of its advantage. I wish to appeal to our people that the conversations that we've been having on social media, and even when we do physical feedback and consultative meetings, have been very useful to me, and I hope that we will continue to do that as we move towards the end of this our term in office.
Okay. Thank you so much for your time. Thank you for tuning in. We hope you now have some information about what is happening in our health sector. Please do join us on our next episode and continue to learn more about the different ways that we can contribute towards the sustainability of our communities. Thank you.